Hello, good afternoon, everyone. Thank you for joining us today for the NORDIC Health 4.0, the Amplified Nurse. Today we have two companies presenting. So first at 4 p.m. we have Modesensors, the next generation of hydration monitoring. And then at 5 p.m. we have thermal scan, which is the early detection of breast cancer. And for tomorrow, we have three sessions. Please take note, the first session will start at 3 p.m. We will start at 9 a.m. in Singapore. We have Mentor Media, which is a comprehensive supply chain services. And at 3 p.m. in the afternoon, we have ASAT, which is a next generation high absorbent disposable sheet. And lastly, at 4 p.m., we have OMSIN, which is a technology that aims to recognize disease and predict deterioration. So the presentation structure, as before, will be 30 minutes of presentation and demonstration, followed by 15 minutes of Q&A. So presentation has started. This is the third day. We'll continue until the 15th of June. Please help to share the information below. The link where the participant can actually sign in is free to attend the presentation section. So if you're unable to be online, still do sign up because we can follow up with you to send you the recorded video on YouTube. And if there are any challenges that you are still facing that is not covered in this presentation, please email to me. I'll be on a constant lookout for solutions. So my name is Nika from Innovation Norway. Here's my mobile number and also my email. So a total of 17 companies from the Nordic countries, which is Norway, Sweden and Finland, have participated in this. So this is the first 8 companies, and this is the remaining companies, total of 17. So without much further ado, let me introduce Henrik. Henrik from Modesensors. So Henrik will be the one presenting on behalf of Modesensors today. So I'll stop sharing, and Henrik, you can take over and share. The time is yours.
Well, thank you very much. Good afternoon, I think, to Singapore. Today from Modesensors in Norway, we have co-founder Göran, Chief Financial Officer, and myself, Henrik Lund, CEO. Göran is an engineer, and I'm a medical doctor. And what we're going to present to you is an area which is very important in healthcare in general, and that is hydration. All of you who are healthcare workers would know exactly what that means. We have made the world's smallest and most versatile adhesive patch, which is mounted on the patients, which can sense hydration to bioimpedance and log this for a week or 2 weeks. It's a very lightweight, very advanced, very accurate sensor. So all of the high tech is embedded into this miniaturization of a fluid monitor. And you can see this patch here mounted on the front of this young woman. And is one of the places where you can have it if you want to measure the hydration. So let me go through and present to you what we can offer. Just on where we are right now, the sensor is going in the version that you see here in the picture to the US Food and Drug Administration, the FDA, within a month or two. It will take 3 to 4 months to have the market clearance in the US and subsequently for the EU. So this is a technology which is very mature. And we also have the first collaborations with providers of healthcare technology that will support us in the commercialization of this. So this is where we are. This is only the first version of a future entry into a very important part of using wearable technology. So this is a very high growth market, obviously, because of the elderly population, the need for streamlining and efficiency and better quality of nursing time, that you're able to control the hydration of patients. So my first slide is focusing on what you already know quite well. The fluid imbalance is a major challenge in healthcare in general. And that goes from acute and serious hospital conditions like colorectal surgery, for example, where people remove their intestine and therefore have problems with water absorption. And it goes to basically a very predominant factor in elderly care, because people forget to drink, whether they are mentally impaired or they have other obstacles to their hydration, which all of you know causes either too little water, fluid deficit, which is on the left side of this slide. And you see some of the ordinary things that you are afraid of with your patients in institutions, whether they should have hypotension, they have syncope, they can fall, and they can have hip fracture, for example. There's also a very, very common problem with constipation, infections, obviously. And if you have too little water, your drugs are not dissolved rightly in your body fluid, so you have over too high concentrations, etc. So despite of that, also the other part, the fluid overload, is very problematic, and often more acutely complicated if you have, for example, too much fluid in your lungs. You will get dyspnea, and that, or in your legs, you get edema. And sometimes the fluid overload can be more acute, dangerous to the physician, to the patient. Therefore, to control this in a constant, continuous monitoring is what our invention is all about. And the label for this type of intervention is actually covering all of the disease areas which you are looking at in the middle of the slide. So it's relevant for general elderly population, for cognitive issues, for renal disease, obviously, when you can't excrete water, for heart disease, where you have too much water in your legs or in the lungs, and as I mentioned, gastrointestinal disease areas, and also relevant for conditions where there are increased water loss. So it is, irrespective of how you calculate it, a rather large increase and massive cost to society. We have picked up a recent publication from Singapore, as you will see here, Arroyo, last year, from the Annals of Clinical Medicine. And the imagery here is clearly pinpointing where this monitoring can save you time. It can give caretakers and family more trust in that their elderly are taken care of on a continuous basis. So it's important to know that this monitor is a continuous, every 30-second measurements of your hydration status. So in Singapore, in this publication, nursing home residents actually, as it's the last sentence here, 1/3 of them had actually dehydration incidents in their stay, and more than 90% of them failed to meet their daily recommended water intake. This is quite an interesting information, actually, that it's so high. It could mean that this is a type of care that it's very time consuming, and patients may not have the right understanding of their situation, how to actually hydrate themselves. So this is basically a global problem in industrialized healthcare, even if it's private or public. So there is an urgent need for this, because you all know how you do this. Nurses and healthcare personnel knows that in most of the nursing rooms or in the individual beds or multi-client beds, there are fluid balance charts usually. There is the clinical assessment, which will not go away, obviously. You can pinch the skin, you can look for the eyes, you can have a clinical assessment of hydration, but still you need an objective way to measure clinical assessment and have a system that can warn you that the patients you're tracking down. It's very tedious to use what's in the lower left part of the slide here, body composition monitors. They're often bulky, very expensive, and the patients needs to get up, walk to the site where this body composition monitor is, and you can always, of course, ask the doctor to, or you can do yourself, take urine and blood samples. But this is very time-consuming, resource-consuming, and expensive. So this is the innovation. It is a very lightweight, very thin hydration sensor where all of the technology is embedded into a flat structure. So it's a miniaturized, the world's first and smallest and most accurate sensor. You can put this on the patient in, I mean, for us who've done it, it takes 15 seconds to a couple of minutes, depending on where you want to put it and how you want to prep the patient. Is an automated, continuous real-time fluid monitoring. It means that you can, at any time, go back and see how the patient has been doing for the last week, for example, to see how many episodes of dehydration he might have. And you can also do the median tracking of the average fluid level. So you get actionable insight about fluid levels, and you can monitor in remote at your nurse station. You can monitor many patients at the same time through a gateway system. It's very easy. The patient don't notice that it's there. There's no adverse events with this. We have a special safety database now, which is quite large, and there's no more adverse events connected to the adhesive patch. It's a class 2 device within the EU and the US. And it's, of course, non-invasive. Very important, the patient can perform their daily routines, their wash, their showering. And we are heading for the first wear time of 7 days for this. So you can change the patch then within a week, or also extend that use or wear time if you like, but the recommended wear time will then be 7 days. So it's a Bluetooth connected device. So the patch actually sends a light signal every 30 seconds to show that it's sending signals, and it's storing all of the information. So it's a computer. It stores it on the patch itself and sends the data to through Bluetooth bedside or to other remote or self-monitoring stations that you might have. So there are multiple product configurations that we are working on right now, but the first version is the one you see here. It has a simple starting button, which you can see in the middle of this, and it can be mounted. You can have more than one patch, for example. You can have one on the leg, you can have it on the thigh, you can have it on the front, the precordial area, you can have it in the back, which is a very nice area for mentally disabled patients. We are now working to expand this. There's also an accelerometer in the patch and also temperature. We're also looking to sleep quality, and for different readout of the raw data, we can also give important information about malnutrition through using something which is a phase angle, and that's connected to the patent that we have on this, which was filed last year. Actually, it was a little bit long time on that slide, but this is what it looks like. Bioimpedance may be new to you. This is our proof of concept slide. And basically the patch which is mounted on, which you will recognize from the transversal slide, which is shown here, it actually sends a small micro electric impulse through the tissue. And the speed at which the electricity moves in tissue is dependent on the solute concentration. If you are dehydrated, the concentration of salts increase. Therefore, the current flows easier. If you are overhydrated, there's less ions, as you recall from your physiology basic knowledge. And by doing multiple frequencies, you can send either high frequency directly through the tissues, or with low frequency, it actually finds the current way through the intercellular space. And from that, you can actually calculate the exact fluid level of the patient. You need to have this patch over a muscle. So don't believe anyone who sells you arm bands, etc., because they are not measuring this real hydration status. The lower left is the correlation curve in our proof of concept studies, where we have used chronic renal end-stage renal disease patients on hemodialysis. This is a very common model because it's so easy to correlate the fluid extracted through hemodialysis to the actual signal from the patch. And you can see that there is a really high correlation, less than 150 milliliters, which is usually 1 glass of water oral taking. So it's a very accurate size, and the clinical data will also be submitted to the authorities for scrutiny. So we're very confident that we will get an approval in the US and later on in the EU for this. So this is what it looks like for you, because when you identify a patient, and as you saw from the initial slide deck here, about a third or more, and in the Scandinavian countries also surprisingly even higher, patients that are admitted to outpatient wards have dehydration as they're entering the ward, and as they would then carry a fluid imbalance risk. It will take you 1 to 3 minutes to set up this. It's basically to take off the adhesive tape, put it on the back, and push the button, and you will see the control light. Then at your remote destination where you measure and control the patients, you will see a traffic light type of signal. Well, the green light, which is a 0, I'm now referring to the figure on the right side of the slide, you will see that there's a green corridor. It's important to know that fluid hydration status is actually fluctuating quite a lot during the 24-hour cycle. Hydration, as blood pressure and other things, have a 24-hour rhythm. We don't want you to run into the patient unnecessarily. Therefore, there is a yellow and a red zone. So you have to, for example, be 10% out of the normal, which correspond to a certain percentage of your body weight before there is a notification to the ward or to the caretaker that you need to visit the patient and usually then administer fluid. And that's very important because all of the so-called point measure instruments, which you need to step onto, etc., they measure at the point where you measure it, and it don't give you a curve like this that shows the hydration status over time. So therefore, there is an alarm logic. And the evaluation of this, of course, needs to be put into a clinical setting. You need to understand what the patient's situation is, that he was perhaps dehydrated when he came in, or some other underlying medical condition. There's an automatic self-calibration to this. So it means that the patients will have 2 hours where the patch will understand the patient, and then have 12 to 24 hours to actually calculate the very large diurnal or circadian rhythm. And you should look at the data from this to see how much variation it is. And it's important to recognize that, because no other sensors actually can then pinpoint the time of day or time of night where actually hydration issues, fainting, falls actually occur. For example, during nighttime, need to go to the bathroom, etc. So MODE has a lot of traction now from both hospital caregivers and also from primary and secondary healthcare providers. We just finished a sort of tour in the US where we went first of all to private hospitals, and we are setting up a trial in oncology with colorectal surgery in the White Plains Hospital Group in New York. And we also have talked to, for example, veteran administrations on the right side. The hospitals that has been part of the testing out of this innovation is given below. It's also municipal authorities like Oslo, which is the capital of Norway, Trondheim, where it is the home city of the innovation, the tech capital of Norway, and you see other collaborators that has been part of this. So the University Hospital has been taking a part, a solid part of the proof of concept testing of this innovation. Here is a little bit what I talked about. If you want to get the patient up, put him in a wheelchair and drive him down to the Department of Internal Medicine, you will meet the device, which is on the far right, which is the present market leader. And we have compared our miniaturized version. As you can see below, it's 25,000 times smaller. It's very practical and effortless. It doesn't need anyone to stand. It is working, you know, supine or prone position. It's very affordable. The price of comparative costly equipment here is about, for the SOSO device from Impediment, which is shown here, about $15,000, $16,000, $17,000. So the innovation is patented. There is on-chip processing, filtering, etc. It's a miniaturized. It's actually the first wearable multispectral bioimpedance device, and it is very accurate. Down to the level of the normal administration of fluid in oral care, and it's very affordable, and it has the ability to personalize for the patients and for the family quite a solid history of fluid balance, so that everyone can know. It's very hard to observe an individual over weeks with many different caretakers being involved to actually understand, and that's probably why hydration is so complicated in the clinical practice. So the value proposition we have for you, and here we have taken data from which is readily available for Singapore actually, and we've taken this from, among others, Yurong Hospital, which is part of the network that was alluded to initially. And if you look at how this is done, we think that you can actually reduce, have a 2 hours productivity gain per reduced time that you use in fluid monitoring, and the average 5-day stays, for example, this accumulates to quite a significant saving for the patients. Now also, it's very clear that many patients do not reach their readiness for being sent out to home or to other care because they are hydrated and haven't managed to get their hydration system in order. And that depends, of course, on the conditions of the patients. But here there is quite so that we think that based on the health economy calculation we're doing, you can actually a half a day or even a day earlier discharge due to the fact that the patients can actually be have their hydration status in order at the day of moving on to home care, for example. So we think that the outcomes for the patients and for the family and for the caretakers in general are better. Lower complications rate, improved patient safety. There's no maintenance cost to this type of management of hydration. There's no capex, straight on investment. And there's, of course, a cost avoidance of infections and the things that I mentioned earlier. And there's no need for sterilization. The equipment is easily mountable, and it can empower the patients a lot to handle their monitoring. I'll speed on a little bit here. So this is actually the presentation of the Modesensors and the patch, which is called Rebalance. And we're happy to move over to the Q&A session for you. These are the key people in this presentation. So I'll be happy to take your questions. So thanks a lot. Sorry?
Hello. Hi,
Hi, Shulan. Yeah, you have a question?
Thanks for the presentation. Yeah, I just wanted to ask, is the solution currently able to integrate like other like brands or models of like, for example, a blood pressure monitor into the dashboard? So let's say if a patient is using an Omron blood pressure, will the dashboard be able to pick up the readings of like the Omron, the BP measures lah? That means able to do any like software development kit with other devices of other more brands.
Well, that's an excellent question. The version that is going in for US clearance now is carrying the bioimpedance and the electronics and the storage. It has accelerometer, which will measure what position the patient is in, and also surface temperature. It does not have a blood pressure unit itself. Neither do we have an AKG, a cardiac rate monitor, which some of the others have. And that is a matter of putting the right chip in. This is technology that's also customizable. However, for blood pressure, you need, in most instances, you need cuff-related technology. So the question is what your question entails, whether it can be integrated into the healthcare API or monitoring system as such. The answer is can work simultaneously with any other monitor, obviously, because it's not inflicting on anything. The only contraindications would be in hospital if you have pacemakers or having acute surgery, etc. But blood pressure measurements in the patch, no, but fully integrated into continuous blood pressure measurement. And even also for patients who have diabetes, you can also do it side by side with other innovations that, for example, will measure continuous blood sugar. These new devices, non-cuff blood pressure measurements, wearables, are very early in development, and so are continuous blood glucose measurements, but they are also part of course, a couple of years into the making. Did I answer your question?
Yeah, sorry. Actually, I just wanted to ask, like, let's say, if we want to do like remote monitoring of patients at home, and the patient has a blood monitoring device. So I'm not sure if this solution is also able to pick up the readings of the BP, the blood pressure device, into the dashboard. Yeah, that means I think it's more of a AP. More of an APK integration.
Shuan, you want me to try to explain? So basically what happened in Singapore is that we are into a lot of vital sign monitoring. We do have a lot of remote monitoring systems, but I think hydration sensor is not one of them. I think Suhan is trying to see whether with all these existing vital sign monitoring system that we have, can this patch, since it's Bluetooth, the data, can it be shared with such system that we already have, so we can have a common dashboard of all the vital signs of the patient? Suhan, is that right?
Yeah, thank you for that clarification, and sorry if I didn't answer that correctly.
Yes, thank you.
Yeah, so thank you for me also. Well, obviously, yes. I mean, in the Nordic healthcare system now, we are having a system that wants to integrate any device, any signal, any biological measurements coming from any remote or any wearable device. And in addition to that, also systems that will integrate all other type of automated patients monitoring, like medication, like blood pressure, like blood samples, etc., etc. So everything can go into the system. This is not, it's fully customizable or even fully operational alongside any other patient monitoring system. It doesn't interfere in anything. It uses a bandwidth for its signal to the gateway, which is then can connect it to visualize in a dashboard alongside, for example, blood pressure. For example, a room monitoring with TV. It can also be alongside, for example, wristbands that some patients have in the Nordic healthcare system now in the municipals. Companies delivering surveillance data for falling, three-dimensional and anonymized picture of patients' situations in the room, etc. So this is a perfect addition that will actually explain and give the background for any caretaker that's looking for why things are happening. Why is a patient prone to fall, for example? Yes, because he's dehydrated and therefore have hypotension. So you can correlate dehydration level with blood pressure. It's important from a physiological perspective also to add that the blood pressure curve, which you probably know is also circadian. It is diurnal. It varies a lot. So your blood pressure is very low around 4 a.m. in the morning. And then it peaks midday when you need to stand up and have your machinery going if you're a normal person. This is also disturbed in many patients who are bedridden. So you can see from the diurnal curve, which we didn't show you in this presentation, that the hydration status is very similar to the blood pressure curve in the same circadian rhythm. So if you have a patients who have a very disproportionate relationship between blood pressure and hydration, you can take appropriate action. So there's no problem of integrating this into whatever dashboard you have in your nursing control room.
Oh, okay, thank you so much.
Thanks, Suhan. So for the rest, you can actually unmute yourself, ask the question, or you can also type it in the chat.
So can I ask a question to the group here?
Yes,
As far as I understand, I mean, you said that as far as you know, there's no direct technical hydration monitoring in place in the Singapore or Southeast Asian healthcare system at the moment, as you recollect at the moment. There is probably in Australia, there are point measurement devices there. But as far as we are not aware that there are anyone who has taken this technology into use in Asia. So it's quite a novel thing.
Maybe any of the nurses online can answer this. How do we actually manage patient hydration level? Any nurses want to answer? They are all too shy.
No, but
okay, I think from what I observe, I mean, I'm not a nurse by training, but I've been working in a hospital. Generally, I think we just manage by the amount of input and output of the patient to understand the hydration level, which, like what you mentioned earlier, these are all paper documentation. Diana, you want to answer? I see that you turn on your camera.
Yeah,
thanks for
I
helping.
think you mentioned it correctly. So we actually do manual monitoring of the patient's intake and output, and yeah, so we will do the balancing at the end of the day, yeah, to just see their fluid status. Yeah, that's about it actually.
Yeah, that's no automated way.
That is my recollection, both from my parents and from nursing homes in general, that there is a glass of water or soda or whatever it is on the bedside, and there is a small paper note. So you take your pen out and you write down what you give, and then sometimes the patient spills it or whatever, and there's another person coming in. So it's a manual accumulative volume load. And then if there's less than, let's say, a liter on that list for a day, and it's 25-30 degrees, then you are not happy with that hydration. And this can go on for days. And then you have to go in, let's say, 6 times per day or more than that. And that is the only system you have. And these paper bits of paper tends to get lost, and they tends to be not properly written down and then transferred to the next team coming on for the patient care. Therefore, we think it's an obsolete system that should go away. So this is a fully automated, very user-friendly type of innovation. And the key here is, of course, that it's accurate. And it is. It's really a wonderful innovation that's been tested clinically. We have 300 patients now in different clinical trial testing, and it works very nice. And there's no hassle for the patient to use this. So we think it's a great potential for saving very valuable nursing time to more intelligent medical support issues than actually run in and out of rooms and write down 100 milliliter every 6 hours. And then that data is usually always lost anyway. And there's, yeah, so this is a little bit of a pitch to the innovation, but I think it echoes what you're saying here, that this is the manual way of doing hydration monitoring. So I think there's a truth to that.
Henry, we got a question from CGH Yunyi. She's asking, what is the accuracy percentage of the clinical trial? If I didn't forget, if I didn't remember wrongly, it was about 1% on your chart, right?
Yeah. So I will answer this question from two lines regarding the corrective measurements from the device. We've done that at the University of Tromsø. So we take patients or healthy volunteers. We administer half a liter of water, hypertonic solution. That's actually soy, very unpleasant to drink in a clinical trial, high glucose or sports drink. And after 5 to 10 minutes, we can actually measure the hydration sensing of the rehydration. So the detection is down to between 40 to 120 mil, which is a glass, and it's rather immediate when the patient is absorbing this in terms of so it's important to recognize that in order for hydration to be a subjective problem for the patient, you need to lose about 1% or 1.5% of your body weight. And that depends of course on patients. So in percentage, approximately 1 liter or 1.2 liters of loss of fluid corresponds to 1.5% of body weight. And within that limit, the percentage accuracy is very high, down to 150 mil. So the percentage accuracy is above 90. When you are in controlled clinical trial setting in renal dialysis, it is a P005 correlation between the fluid level down to roughly 400 milliliters for hemodialysis. And of course, the accuracy increases as much more fluid you take in clinical trials. But I refer to this accuracy in the slide that you show, where a linear curve between extracted fluid and amount of fluid extracted from the patients. There, the accuracy is extremely high. So the correlation coefficient there is 0.94, which means a 94% accuracy in clinical trials. Did that answer your question, Yun?
Yes. Any more questions from the floor? Okay, maybe if not, I have a question actually. Unfortunately, my father recently was diagnosed with some heart problem, and that actually affects his kidney performance. So he was given this medication to dehydrate because he was having swelling legs, lower limbs. And I find that it was a very big challenge when he's at home. Then he couldn't drink too much water. If you drink too much, his legs start to swell. And you never know how bad is your hydration level unless you go to the hospital to be measured, right? So I was wondering, such a solution, I mean, especially for home care, since it's real time, it's continuous, is there a way that this can be used to give advice to the patient who is having hydration challenges on how much water to take, as to when, and how and the level amount of water to take?
Thank you. That's a great question, and also from a personal experience within the realm of taking home care of starting renal failure. As you probably know, if you have starting renal failure, the physician will always try to get rid of your excess fluid by using diuretics, that's water expelling medication. And for control of the level of renal failure, the physician will take blood samples and send them into the central hospital for analysis of renal function testing. That's usually creatinine, urea, which are the deposits that are generated and the body needs to get rid of. So by taking these blood samples, he can give a quite accurate description of the level of fluid overload. However, with our innovation, we can actually measure this with the same accuracy as the blood tests. So it means that the correlation between the bioimpedance signal from renal patients corresponds very well to the level of overhydration without taking the blood samples. So we've done that in St. Olav's hospitals, in Trondheim, and also in Levanger Hospital. So there's a very nice correlation between these normal routine blood samples that the patients need to take. And therefore, you can actually foresee that this can replace many visits to the hospital for the in this case, your father, or for other to actually take, because there's no other way that the physician or renal physician, nephrologist can actually know the amount of fluid overload that is emerging in a patient. So we've done that because in all our clinical trials, we've taken these control blood samples that I was referring to and correlate them to the amount of fluid the patient has. So there's a very, very nice correlation, the same level as the fluid extracted, actually. So there's a very good correlation that this can be a proxy or even a replacement of the required blood sample testing for hemodialysis. That's why this technology is now entering into as a routine part of the more severe patients with renal failure, which we hope your father will not enter into, obviously. He's probably in a situation where he can manage by diuretics, but it's very hard because if you take too much diuretics, your blood pressure will fall and you will have...
Yeah, right. It's a lot of medication and he's getting very thirsty, but he's not able to drink water. So it's quite suffering for the patient.
Yeah, so this innovation would be a very nice addition because it also means, as I was referring to, that the physician can extract a week or two of hydration episode and see if he's tracking at the right level. And you do not want to send him to the physician for blood sampling every time he thinks that he's had a worsening of his condition or the other way around. You want to have that objective measure of a time slot of hydration, show that he's tracking below. Then it means you can adjust your diuretics medication or your blood pressure regulation, etc., according to this type of historic. Because a blood sample is a point measurement. It's a point measurement the day. And if you sit in a queue in 6 hours before you come to the hospital, you're even dehydrated. And then, so that is the beauty of continuous hydration monitoring, I think, with your example that you're taking here.
Okay, sorry, I think we're running out of time. So let's wrap up.
Hi, sorry, just one last question, right?
Okay, sure.
Monitoring, is it done via an app or dashboard, or do you need a PC? Yeah, I mean the monitoring of the hydration level by the clinicians.
That's an excellent question. I mean, there are many different systems. We don't know what these systems are in Singapore at the moment, but it is customizable through the API. I had some slides that were covering this that could explain this. I might take them up, but time restricts me. But right now, for demonstration purposes, the things we showed you is available on iOS, the Apple platform, but it can be programmed to any platform that the healthcare provider is using. So that's a matter of adoption through program. It's a fully programmable for the output. But for the demonstration purpose, if we are lucky to get to Singapore, we will probably bring the iPad or the watch for you, so you can you know, you can put it on the patient's arm, or you could have it so it's an iOS compatibility right now, so you can read the curve straight out.
But not to worry, we don't have to wait for you to come to Singapore. We can get that information. I can share with the those that's attending this session.
Yeah, you can.
Yeah, we
so
can.
We can
we
set
can
up
get.
Another...
Yeah, for those who want screenshots or whatever of the information that is generated from this system, yeah, drop me an email. I'll follow with Henrik, and also you want to get the information.
Okay, thank you.
Thanks,
yeah, thank you, Lau. A very nice question, but remember, there's quite a lot of systems out there.
Yeah. So for those who are interested, want more information or samples or whatever, this is my email as before. You can contact me. I will try to get samples into Singapore that you can try out. And like what Henrik say, we could be making a trip to Singapore sometime in September. Hopefully we can visit your hospital as well and to share the information with you. And
so from our side,
sorry?
No, from our side, Göran and myself, thanks a lot for this afternoon with you. And any questions you would have, please also go through care. And if anything, you can also watch our website or take contact directly through the contact points which are given in the presentation. So thanks a lot.
Thank you, Henrik. Thank you, Johan. Yep. So I just want to mention the next session tomorrow. We have 3 companies, Mentor Media, ASAP, and also OSIM. So again, thank you for attending this session. And again, if you have things you want to follow up on more information, just contact me. Thank you and have a nice day. Bye.